Live from Washington, this is a special Your Voice, Your Future National Town Hall, Ebola in America.
Ebola, additional cases of Ebola,
symptoms of Ebola.
Whether it's in a practical sense or one of panic.
I don't feel safe.
The disease that so firmly grips its victims has also taken hold of our daily lives.
We have to work now so that this is not the world's next AIDS.
The first real sense of alarm, a Liberian man, Thomas Eric Duncan, brings Ebola to Texas. The outcome proves fatal. Meanwhile, 2 nurses who treated him become infected.
85% of the nurses say they are not adequately trained.
Their friends and family under careful watch. And while airports get new rules, there's a rush to find a vaccine. And at the same time, educate.
The way you get Ebola is by direct contact with the body fluids of an ill individual.
Medical specialists agree it must first be stopped at the source, in Africa.
We're glad you're here, man. Hoorah.
Hundreds of U.S. troops are now on the ground, building hospitals and assisting in quarantines. Spain, Germany, France, more cases popping up. Is it all, though, lacking perspective? This a real-time, dizzying display of Ebola mentions on Twitter.
The prospect of an outbreak here is extremely low.
And on the same day, nurse Nina Pham is declared cured.
I believe in the power of prayer.
A new case pops up in the city many worried could be the worst place for it, New York. A doctor recently working in Guinea.
A team went out with protective gear. He was picked up.
And precautions reaching a new high. A nurse back from Africa quarantined in New Jersey despite testing negative.
Joining us for tonight's Town Hall, Dr. Scott Betzlos, Chief Medical Officer for Inova Fairfax Hospital. Dr. Ben Carson, former Director of Pediatric Neurosurgery at Johns Hopkins Hospital. Congressman Jerry Connolly of Virginia. Nelson Sabatini, former Maryland Secretary of Health and Mental Hygiene. And registered nurse Rajani Ward.
Good evening and thank you for joining us. I'm Scott Thuman. Over the next hour, we are talking about something that is clearly on the minds of many and has become a top priority around the country and the world, the Ebola virus. And there is some big news on this day regarding quarantines, with some politicians, even the Pentagon, countering what the White House has advised. The Army will now isolate all troops who return from serving in Ebola-stricken nations and monitor them for 3 weeks. To that point, a 2-star Army general and 11 members of his staff have just been quarantined in Italy after a mission in Africa and are being monitored for symptoms. And the nurse you saw in that video, quarantined to a tent in New Jersey, has now been allowed to go home. On top of all of that, just in the past hour, the CDC announced new recommendations that people at highest risk avoid commercial travel or large gatherings, even if they have no symptoms. We know there are a lot of questions about this disease and how we can stop it, both in devastated areas of Africa and here at home. I am joined by this esteemed panel, Dr. Scott Betzlos, Representative Jerry Connolly, and Nelson Sabatini. Welcome, gentlemen. We appreciate you being here.
Great to be with you, Scott.
This hour, we're also going to speak to registered nurse Rajani Ward from National Nurses United and renowned Dr. Ben Carson, who is joining us from Seattle. We want your input as well. We encourage you to join our conversation using the hashtag #YourVoiceYourFuture. We also have physicians standing by to take your calls. It is all happening in our social media center. That is where Kai Jackson will be monitoring activity throughout the hour. Kai?
Scott, we have a lot going on here. This is the social media center, and what we're looking for tonight, we want to hear from you. As Scott mentioned, you can hashtag #YourVoiceYourFuture to Twitter and give us your thoughts and your questions about how to deal with Ebola. So we're going to show you your comments, what people are saying, and perhaps one of the best ways to get rid of misinformation is through facts and through science. Also in our social media center tonight, we're very, very happy to have 2 infectious disease experts from a local hospital. They're on the front lines trying to find ways to battle Ebola. Tonight, they're going to be manning our phones and answering questions from you, our viewers, that you have about Ebola. So I'm going to maintain the social media center here. Our phones are ringing right now. We ask you to call in and let us know what your questions are. We're going to go back to Scott. And when we do have questions, when we do have comments, we're going to pose those to our guests in the studio. Scott, back to you.
All right, sounds great. Thank you, Kai. I want to begin with what just happened in the past hour, and this is the recommendation that we saw from the CDC about large groups avoiding certain commercial travel. Dr. Betzlos, why are we just now getting this? Are we late to the game on these recommendations?
No, I don't think we are. I think that as you see the responsiveness evolve over time, as we become to better understand Ebola and to better understand the psychological component within the country, I think you're seeing appropriate reactions and proactive actions that are taking place, and this is just one of them.
But why now? Well, why didn't this come out weeks ago?
In terms of the commercial travel for high-risk patients, probably could have.
Yeah. Here's the thing: you had at one of your hospitals, we had a potential scare. You had a patient who came in. There were some questions about symptoms. Are we prepared? Were you all prepared?
We were prepared for this patient that came in. You're speaking about the patient from the Pentagon.
Yes,
yes, we were prepared. We actually developed a special care unit where we can take care of these patients, but also designed our emergency department to handle a patient with suspected Ebola. Our nurses were trained with PPE to care for these patients, and everything clicked off very well when that patient arrived to our emergency department.
The quarantine's been the subject of a lot of controversy, and we have been asking people all over the country to give us their questions, many wondering, am I next? Listen in.
I'm Rob Lifflander from Greenwich, Connecticut. And my question is, at what point is the city going to require people who might possibly be infected to stay under a 21-day quarantine?
Gentlemen, anyone want to chime in on that? I mean, the subject is whether or not these 21-day quarantines for someone who seem to be at risk are a good idea. Do we agree that it's a good idea at some point to quarantine?
You know, it's an interesting question, and I think it has two components we need to discuss. First, the psychological component of the community that you're in, and secondly, the scientific basis of the quarantine. And I think those are two separate discussions that converge onto this.
Okay. Dr. Ben Carson joining us now live from Seattle. And Dr. Carson, I'm curious, you've been outspoken on the issue as well. Are we handling this correctly? Do these quarantines need to be more thoroughly examined as an option, or was it a bit of panic that we saw in New York and New Jersey over the weekend?
Well, I haven't really seen what I would describe as panic. Certainly people are very concerned, and for good reason. This is an extremely dangerous disease. And even decades ago, you know, when people would come into this country, you know, they were screened quite carefully. At Ellis Island, if there was a question of them carrying some infectious disease, they were quarantined. You know, these things have precedents that go back quite some time. I think we're learning as we go. And I think perhaps the reason that some people are a little unsettled is because, you know, we're not getting consistent responses, and we're getting changes. And particularly when somebody tells you there's nothing to worry about, everything's fine, and then somebody comes in with the disease and two of the nurses, you know, catch it and they're supposed to be well protected. Obviously that doesn't foster a lot of confidence. So at some point I think it's worthwhile to think logically. What I always do in these dilemmas is ask 4 questions. What's the best thing that happens if we do this? What's the worst thing that happens if we do this? What's the best thing that happens if we don't do this? What's the worst thing that happens if we don't do this?
Sure, best case, worst case scenarios, yeah.
You ask that in the case of quarantine, and I think you can come up with a pretty good answer.
Okay. Dr. Carson, thanks. We'll check back in just a bit. In the meantime, I want to go to our social media center downstairs. Kai Jackson, speaking of questions, you're getting some of them now, right, Kai?
We are, in fact, Scott. Our infectious disease experts are on the phone as soon as the show started. The phone bank pretty much started lighting up. So our infectious disease experts are getting questions in from the public. And we want to encourage you to call. You can call into our phone bank at 703-647-1533. Let me repeat that number, 703-647-1533. Now, Scott, we're also getting some hits on Twitter as well. Here's one of the questions we have tonight. How are hospitals preparing for Ebola? How can we ensure that all hospitals are prepared to handle an Ebola patient? I think that's a very general question that, Scott, you and I as reporters often hear out in the public. Let me throw it back to you and see how our panel of experts would like to answer that question. Scott?
Doctor, I think the best part of that question was implying should there be a standard. What happened in Texas, and we all admit there was a mistake there, but what happened in Texas, the nurses have gone on record in saying they kind of went at it on their own. They first went in with relatively unprotected gear, perhaps considering the gravity of Ebola. And then they took steps on their own to double glove, to use full body suits. They went above and beyond what the CDC recommendation or standard was at that time. Doesn't there need to be a standard across the board for all these hospitals so that we know what we're dealing with?
Sure, it sure does, Scott. And I think that a very structured approach to PPE, somewhat what I previously described, is what needs to happen at very large health organizations across the country to prepare their health systems for this, for a potential patient should they come to their hospital.
Please.
I think the short answer is yes, and the nurses are right. There has to be a robust set of standards for how to deal with Ebola. That does not mean every hospital in the United States is going to be able to comply with that, and therefore they're the wrong place to go, some of those hospitals, if in fact you're showing symptoms that are suspected because of where you came from of Ebola. So we need to recognize that. But I mean, this is not a new challenge for the United States. We have standards for epidemics. We have standards for chemical or biological attacks. We've done a lot of emergency preparedness since 9/11, and many of our hospitals have robust stand-ups to deal with that. But not all of them have the capacity for isolation and protective gear. And as Dr. Betzlos said, there are challenges in working in that environment for medical personnel.
Okay, so Rajani Ward, I want to check in with you again because the study that your organization, National Nurses United, claims to have done surveyed some 3,000 healthcare workers and nurses at 1,000 hospitals, every state in the district represented in that survey, and you claim that 85% of nurses feel that they aren't adequately protected. That goes into the idea of having a standard and having preparation. Where do you think this is going to go? Don't you at some point believe there will be a standard? All the equipment would be provided to your nurses, or as the congressman just pointed out, not every hospital can be situated for something like this scare.
I mean, my answer to that would be that, as I already mentioned, you know, a congressional or an executive mandate for those standards. I do recognize the standards and precautions, and a lot of hospitals have gotten better, but it's been like a very evolving response to this Ebola crisis. But I would say that, you know, 85% of nurses is a lot of nurses in the country that believe they're not prepared. And
all right, Rajani, that's a great point. Doctor, they feel unprepared, even if you say in many cases
they probably do, because, you know, 85% of the nurses are not going to manage the Ebola patients. Right. It's a very subset group of nurses within a hospital system, a hospital that will actually manage the patients. We're talking about we have, you know, thousands in our organization, and we're talking about a subset of probably no more than 50 that will actually care for an Ebola patient.
Okay, and that's an important piece of perspective there. Yeah. You were ready to say something else.
I think there's also something I agree with the congressman. You know, not every hospital in this country should expend the resources necessary to care for an Ebola patient. But by the same token, you never know when an Ebola patient is going to walk into the door of that ER in some small rural hospital. And there are levels of standards. There has to be a standard that protects the people at the initial impact
there shouldn't be question marks when someone walks in.
No, you know, I mean, what I really find frightening is we're embarking now on the beginning of the flu season.
Well, and
symptoms are going to, many people are going to be presenting themselves.
And let's go back to that.
We need to get you all need to get flu shots.
And that was the recommendation. I interviewed Dr. Richard Besser the other day, who said, I hope that this makes people go out and get their flu shots. Exactly. And we're going to talk about the flu and numbers regarding that for some perspective in just a bit. But we have been talking about the folks who are concerned all across the country, especially young people as well, who are attuned to this and trying to educate themselves. And here's what one college student in Oklahoma wants to know.
My name is Jonathan Parker from Tulsa, Oklahoma, and my question is, what is the plan of action for containment if it was to hit a university?
So if we're talking about a large population, obviously a transient one when you talk about students, have we thought about that? Has that been something that's been addressed, or is there a war room over at the CDC and NIH where they say if suddenly we see an outbreak, not just a case or two, but an outbreak among a population like that at campus, do we know what we're going to do? Or is that just unreal?
You know, that's a completely different scenario than what I'm sure we're planning for right now, and that's a game changer.
What we're seeing in Africa, specifically with families in those 3 countries, when one of them does become ill, they don't go for help because they fear it's a death sentence.
That's right.
And when they don't go for help and they stay in the home, the infection becomes larger, the circle of people who are affected becomes larger. So fear obviously can hurt the cause as well as make it a longer lasting effect, right? What were you going to say, Nelson?
Well, Dr. Carson touched on this in his earlier comment about lessons from the past. If you remember in the early days of the HIV epidemic, testing was done anonymously. Testing was done anonymously because we knew that if you didn't do it that
They
way,
wouldn't get tested.
the stigma attached to the disease, in part because of the populations that were being affected at the time, would result in people not being tested and and the spread being increased. So I think we want to encourage people to to come in and get tested. I mean, the doctor in New York, I think, did all the right things. Okay, he came back. He was asymptomatic. Okay, but he watched himself very, very closely. At the very first sign of a symptom, he picked up the telephone.
But a lot of people would argue that he didn't, and they're going to say it's because even though he was asymptomatic, even though he didn't show signs, they would say out of an abundance of precaution, maybe you don't get on a subway, maybe you don't go bowling.
Well, you know what? A lot of people are going to say a lot of things, and they're going to continue saying those things because of the mixed message they're getting. I mean, you said earlier, should we quarantine? Well, I don't know. I mean, I can tell you what people were saying 2 hours ago. And the administration was not saying the same thing that the military was saying, and the governors of New York and New Jersey were saying something different from both.
A lot of people on a lot of different
pages now
right
changed
now cause a
it.
problem.
The governors of Maryland and Virginia are now saying something different than what those 2 guys are saying. And at some point, I mean, you can understand why the public is going crazy.
And again, we have to remember about transmission. We do know a fair amount about transmission of Ebola. This disease has been around since at least 1976. You're not going to catch it because somebody's riding on a subway necessarily. I mean, the 2 nurses in Dallas who did get it were in inadequate protective gear
and dealing with the worst
dealing with bodily fluids from a man dying of the
he was at his absolute worst. But it doesn't change the fact
that transmission increases as the severity of illness increases.
Right.
So when you just have a fever, your transmission capability is much different than if you're severely ill.
But because, and we're going to go to Kai Jackson in the social media center here in just a second, but the reason there is that fear of perhaps I could get it on a subway, the reason that exists is because we have had mixed messages. So people didn't inherently trust what was being said either by the government or the CDC or NIH or a local hospital. And so there were question marks by people who were either skeptical, cynical, uneducated, or frankly just didn't know if the government had its act together and therefore are doubtful. And that's reasonable that they would have those doubts.
And I want to just say, I agree with that. I think people who have been from the affected areas, even if they're symptom-free, should use great social caution to limit anybody's exposure.
Let's talk about the flu. Let's give me some perspective on this, because a lot of people will say statistically you could just look at what we've seen with the flu over the years and compare it to Ebola. Now I know that's an apples and oranges to some degree because the severity of the fear factor that's attached to Ebola will, regardless of statistics, create a bit of panic in people.
Right.
But doctor, the flu has done more damage than Ebola ever will in this country, you believe?
True, but I think we need to really understand that what we're saying here is that Ebola kills indiscriminately, regardless of your past medical history or predisposing factors. It kills indiscriminately. The flu, if you're going to die from the flu or have a mortality from the flu, you're more likely to have predisposing factors, diabetes, long-standing hypertension, be elderly, be bedridden. And those are the people that generally die from the flu. So Ebola kills indiscriminately, and I think we need to make that distinction.
Although it is interesting to note, in the 1917-1918 influenza epidemic, it actually didn't affect those populations as much as it did healthy populations. So if you were doing triage then, it was the obverse of today. It wasn't immune-compromised older populations. It was healthy young populations who succumbed the fastest and were the most vulnerable because the antibody systems reacted so strongly to this new foreign entity that they actually, in trying to save the patient, killed the patient.
As we mentioned, we've talked with a lot of people about Ebola, got their thoughts, and this one kind of summarizes a lot of what we heard.
Two questions I would have is, are we convinced that all of the really painful screening at airports is actually making a difference? And just if you live in a busy city or you travel a bunch like I do, what should you do to just keep yourself safe?
How confident are we in what's taking place at the airports?
I think the screening procedures are doing their job. They're identifying patients that have fevers and have symptoms. And I think that's important in terms of the transmission capability.
People are going to say that what they saw, and this was early on, obviously, this is before we knew what we were dealing with, but people are going to say, well, Thomas Eric Duncan might not have been truthful about where he'd been or if he'd been around people who had directly had Ebola. So there's doubts in the system. Now, the system has changed a lot in those weeks. Right. But are you confident, Congressman, you oversee a lot of these committees that discuss things like the safety measures in place. Are you confident that what's happening at the airports is A, worthwhile and B, effective?
Well, you know, I guess I'm never going to be confident until something is foolproof and 100%. And that's what we're working toward. The protocols in place at our airports are filters. And I think, again, we have to remember, to the gentlelady's question, we're not talking about an infinite population that arrives every day in the United States. This is a very finite number. We know how many it is. It's about 150 at most per day. We know we can track where they're coming from because they're coming from third countries. And we can, as a first filter, check them out at airports, right? Ask them questions, look at symptoms, take temperatures, and ask for voluntary compliance in terms of monitoring if you've been to one of the affected areas. And more can be done, of course, once you get out of that system. Is that system working? By and large, so far, yes.
I think that I mean, there's no system that is going to be foolproof.
Exactly.
I mean, you're not going to.
But we want to move that direction.
But I think we should try to move in that direction. I also think that there is a certain deterrent effect to having those screenings in place. I mean,
how so?
I can't tell you what Mr. Duncan was thinking. And he obviously knew that he had been exposed to the virus, and he was at high risk. Yeah, he was not truthful when he came into this country. And now, if he'd have known that there were screening protocols in place, and that those things were going on, maybe he wouldn't have tried it. I don't know, but so I think there is the deterrent effect that makes these screening protocols worthwhile.
Can we talk about? And I want to bring Nurse Rajani Ward back into the conversation here because, as we mentioned, flu earlier. There was an analysis done by someone not too long ago saying that if people don't get the flu shot, and suddenly they experience flu-like symptoms, there will be panic among some. It may be a very small percentage of them, but they will show up at a hospital thinking they may have Ebola. The numbers will alternate. You'll have panic, or you'll have some people who remain calm. They might overlook symptoms that in theory could be worse. Are you worried about the number of people who are going to show up at the hospital during flu season now and say, do I have Ebola?
I mean, the reality of that is we want everyone to get your flu shot. That's important. But, I mean, if someone comes to the hospital with that concern, ideally they would be screened adequately, to take that seriously. So, I'm not worried about it because hopefully the people that screen them when they come to the hospital, do an adequate screening. So.
Doctor, do you worry about flu season?
We're screening everybody that comes to the front door or any registration point, any touch point within the hospital. You're getting screened in terms of where have you been in the last 21 days? Do you have symptoms of a temperature, fever? If that's the case, mask, isolate, and escalate the situation. And, it'd be nice not to have more people presenting with fever, but if you have to have fever plus to travel, right, at this point in time.
Yeah. It is a combination that's important. Let's go to Dr. Carson, and what I want from you, Dr. Carson, if you don't mind, is we start to wrap things up here a tiny bit, is I want to know where you think we go forward from here. A lot of people are throwing around dates, and there's no deadline with this disease. There's no way to put a cap on when we're going to have it handled. But at the same time, do you think this is something that can be managed in a matter of months? And where are we on a scale of 1 to 10 progressing toward a goal?
Well, I tend to be an optimist because, the system that we have in this country is by far the best in the world, regardless of some of the other things that you've heard. and we will adjust in an appropriate way, assuming that we don't have, a large outbreak. I think we should take advantage of all this attention right now for viruses to educate people about the flu. Tens of thousands of people will die of the flu this year. Very few will die of Ebola. And if we can get people into the habit of washing their hands, using sanitizers, and taking the other precautions that we know, a lot of lives will be saved by doing that. But again, I would go back to what I said before about Ebola. The real focus needs to be in Africa. If we don't get it under control there, it doesn't matter how good our protocols are. We're going to be inundated.
All right, Dr. Carson, thanks so much. Real quickly, Kai Jackson in the Social Media Center. Kai.
Well, Scott, we want to thank our two doctors. They are infectious disease experts who have been answering questions all night about Ebola. Again, clearing up some of the myths, some of the fear. And again, they also agree one of the best ways to get rid of fear, to kill it like you kill a virus, is with science and with facts. But we've had Twitter comments coming in. We've had the phone bank lighting up all night. And again, it's not too late to voice your opinion about this. Hashtag your voice, your future. You can also call 703-647-1533 and pose your questions to our infectious disease experts. From the Social Media Center, I'm Kai Jackson. Scott, back to you.
All right, thank you, Kai. Gentlemen, let's go through some final thoughts here. Where do you feel your greatest level of confidence that we're on top of this, and where is your greatest concern? Doctor?
I think the hospitals are really ramping it up in terms of preparedness and ability to care for these patients in a safe environment. I think that if you take a look at some of the construction that we've done and put in audiovisual cameras in these rooms to talk to the patients and have visual contact without having to go in the room, every 5 minutes. And I think that's a real differential that we didn't have that, a year ago or even a month ago. Mm-hmm. And unless you have to put hands on a patient, you're not going to be going into the room to care for that patient, but you'll have full audio-visual contact, and so will the family have that same contact that we have as healthcare providers. And again, my biggest concern is what's going on in Africa and the R value. It's doubling or tripling. I think we really, really need to watch that and take care of it there.
Nelson, what's your greatest reason to be confident here moving forward?
Well, I'm confident because I can see the way the hospital industry responds to things like this. And they respond quickly, and I think they've come a long way in a relatively very short period of time already. My biggest concern is that we seem to be forgetting that only a fraction of these possible people are going to be presenting themselves initially at hospital emergency rooms. We have other entry points into the healthcare system. And are we doing enough for the individual community-based physician office? What do they have in terms of protection? And what will they do? And what are they supposed to do? You've got neighborhood community health centers, health department clinics, the whole host of these other access points. CDC, or the CSC minute clinics.
Congressman, you've got your hands full, according to...
And what are we doing about those points?
All these patients present generally now with, all physicians have electronic health records, and built into the electronic health record are the screening questions, regardless of your touch points. And assuming most physician offices, with meaningful use in the ONC, putting in electronic health records in the outpatient physician side, these screens are built in, and it's very important.
Congressman, your final thoughts here?
Well, I think after some missteps and after some glaring weaknesses in the whole system, we've come a long way, as Scott said, in terms of filters, in terms of prevention, early prevention detection at airports, at portals for people to go to should they, in fact, be detected with symptoms. And I think Americans can feel more confident today than they could a few weeks ago even, that actually a lot of protocols and guidelines and systems are in place to protect this public. But at the end of the day, we must focus on West Africa. This battle is won or lost there.
Yeah, I think everyone tonight has agreed that Africa is where it has to not only end, but we have to recognize why it began and how to prevent it again. Gentlemen, thank you so much. Unfortunately, that is all the time we have for tonight. We'd like to thank our panelists here in the studio. Very educated evening here, who joined us from across the country as well. Thank you for tweeting your questions and joining in on this conversation. We appreciate it. It is not the last conversation we'll have on this topic, that is sure. I'm Scott Thuman. Good night, everyone.